The questions were many for the health officials gathered at the GIS studio on March 11th to provide updates on the novel coronavirus. According to officials, a 15-bed isolation center has been set up within the Victoria Hospital. Dr. Sharon Belmar-George is the chief medical officer.
I will commence by giving an international and regional update on COVID-19. Based on the WHO coronavirus disease situation report, as of March 10th, they've reported a total of 113,702 confirmed cases globally, with 4,012 deaths. Outside of China, a total of 32,778 cases with 872 deaths. A total number of countries, 109 countries are now affected. There have been 5 new territories that have increased in. To give you an idea, on a regional level, we have 5 cases in the Dominican Republic, French Guiana, 5 cases, Martinique, a total of 3 cases, St. Martin, 2 cases, St. Bartholomew, 1, and Jamaica, as of yesterday, 1 confirmed case.
Given Martinique's proximity to St. Lucia, Chief Environmental Officer Parker Ragnanan reveals that measures are being taken to screen passengers.
The ferries that are coming out of Martinique and other vessels, we have nurses now that are taking individual temperature reading for the persons that are coming off. And that has been done individually. Therefore, what has happened is that the vessels are now disembarking passengers row by row.
Ragnanan says the new measures will cause a delay in processing at the ports. However, it is vital to safeguard the nation. The official reveals 50 handheld temperature scanners were ordered and have been received. Moreover, Dr. Belmar-George says a budget upwards of $100,000 has also been approved for COVID-19 preparations. She also outlined the country transmission plan at the community level, with 5 medical centers for persons concerned about COVID-19.
We are looking at the Soufriere Hospital, the Dennery Hospital, the Grosley Polyclinic. We are still trying to confirm between using the Leclerc Wellness Center instead of the Castries Wellness Center, because we have some concerns with the flow of patients at the Castries Wellness Center. So we're looking at the Leclerc Wellness Center for the Castries Basin and the Vieux-Fort Wellness Center for the South.
As for the suggestion of Rat Island as a quarantine center, Dr. Belmar-George dismissed the suggestion. However, she did harp on the alarming trend of discrimination against persons of Asian descent.
We continue to get reports of stigma and discrimination to persons of this descent. Even within our community service, we had to stop one of our very important collaborations with the Japanese. The level of disregard and stigma that they were getting within the community, it was very embarrassing. And for a group that has worked with us very closely, it was very inconsiderate what was happening at a level of the community. And we would also like to appeal to the public that a lot of damage is being done to us as a country when a lot of those false reports commence, and then we forward them to other persons as the truth. It is affecting us on a regional level and on an international level as well.
She says fake news diminishes the credibility of the country. Acting Divisional Officer at the St. Lucia Fire Service, Jermaine William, also warned against stoking widespread panic and alarmism.
We have found that persons who now just cough are frowned upon and pushed aside. So we're asking persons to be very tolerant. We're asking persons to observe the general rules as it pertains to dealing with persons with infectious diseases. That was just an example. All right. So the washing of hands, the avoiding contact, direct contact is important, and generally we ask persons to be very, very careful.
The fire service affirms training sessions have been positively reinforced to handle any eventuality of COVID-19. Solange Alfred, HTS News Force.